Hi everyone, this is Neel Raithatha, consultant audiologist and director of CRAYON. Thank you for joining me in my latest video using the iClearScope endoscope. And we have a patient here who attended with a blocked left ear, and they've got this really clay type consistency of earwax, and they had been using a Q-tip or cotton bud, as we make reference to it in the UK. Just there, you can see there's an indentation. And subsequently, they have caused some trauma to the front section of the ear canal. It's not visible yet, but during the course of the procedure, you'll see some damp, dead skin collecting on the anterior canal wall, so the front part of the ear canal. And underneath that, there is some granulation tissue. So granulation tissue is inflammatory tissue, so your body produces it as part of the healing process sometimes. And it's essentially connective tissue, which undergoes a process called neovascularization. So it forms its own blood supply, has its own blood capillaries. And granulation tissue looks quite fleshy. It's quite bumpy, it's quite red because it has got this neovascularization. And when you remove granulation tissue, and sometimes you're not aware that you're even removing it because it's hidden away, you rupture these blood capillaries. So you do get some localized bleeding, and I was worried initially, did I cut this patient? But at no stage did I feel I did. The patient at no stage felt uncomfortable, and then it was only later that I realized there was some granulation tissue present, and that was the cause of some of this blood. So I'm using a combination of microsuction and the Rye Correct. Given the consistency, however, of this wax, although the Rye Correct did remove quite a substantial amount here, it was also smearing and smudging some of it at the floor of the ear canal. So I'm going to revert back to microsuction in a moment. Now this patient suffers from really dry, itchy ears. You'll see as we're entering the concha bowl. So the concha bowl is this part of your ear, and you can subdivide the concha bowl. You've got the cavum concha, which is the main bowl of the body, at the bottom, sorry, can't get my words out, and the cymba concha, which is the top section over here. So that part of this patient's ear is very, very dry. So they may have a bit of eczema. I've just advised this patient to use on a regular basis some medical grade olive oil spray. And you can see some of this dry skin at the floor of the ear canal that's enveloped itself around the wax plug, and it's still attached to the canal wall. And just on a weekly basis. So the way I've instructed the patient to use the olive oil is to tilt the head to the side, so the ear that they're putting it in is facing towards the ceiling. Squirt a couple of drops, or maybe 3 or 4. Let it sit for a few minutes. So you want the drops to penetrate, you want it to go deep in the ear. And then after a few minutes, come back the other way, let it drain, to place a tissue there. And then you can do the opposite ear whilst this one's draining. No more, you don't really need to do it more than on a weekly basis. I think otherwise you're possibly over using the drops. But the trick is to make sure you drain it. That's the key. Otherwise, you're just going to if you keep your ear like that, any wax that is in your ear, you're going to soften it, and it's going to drizzle the wrong way. It's going to go towards your eardrum. It's going to block your ear. And also to avoid water in their ears, because water can actually be the root cause of dry skin. So our ears produce natural sweats and oils, so sebum, and there's oily sweat produced by modified sweat glands in the ear. And they serve as a natural moisturizer. So they sit on the surface of the skin, and it prevents the skin that it's sitting on from drying out, because it helps the skin retain its internal moisture, because being oily and greasy, it's hydrophobic. Now, what water can do is do 2 things. First of all, it can wash away, it can leach, especially warm water, these natural oils and sweats that our ears produce. Which then exposes the underlying skin, and the underlying skin is therefore no longer able to retain its internal moisture. So water in the underlying skin, it rises to the surface because there's no protective medium there, no hydrophobic layer, and then it evaporates. So this is that, you can see that damp skin there, and underneath that there's some granulation tissue, and you'll see that in a moment. Also, what water can do, once it's leached away these oils and sweats, skin is hydrophilic, it absorbs water. So the top layer of skin, the epidermis layer of skin, will absorb the water, it will overhydrate. And when it overhydrates, it will swell, expand and burst and break up the membrane. So you can get a deterioration, a degrading of the epithelial layer of skin that lines the ear, and that's the protective layer of skin. So the one thing just I've advised patients to avoid water entering their ears. So you can do that in different ways. So the simplest way is if you're in the shower or bath, you just close your tragus over your ear whilst you're getting water on that side of your face. Some simple cotton wool with some Vaseline. Be careful not to put it too deep in the ear, however. Just at the entrance, you want to create a seal. You can get silicone or foam swim plugs, which the silicone ones, I think you kind of twist it in, but I'm not a fan of that because as you're twisting it, you can be grazing the skin. But the foam ones, you squash, put it in, let it expand. You can get some silicone swim putty, for example, which it's moldable, you can shape it. And again, you just want to create a seal at the entrance. You can get custom swim molds. That's where an audiologist takes an impression of your ear. And there's the granulation tissue, by the way. You can see it on the side of the suction tip. As I mentioned earlier, it's quite fleshy. Yeah, so once an audiologist has taken a cast of your ear, we can have it sent off for a custom swim mold, so it fits your ear like a jigsaw piece. You can actually put some olive oil spray in your ear prior to getting into the water, so you're giving your ear this natural hydrophobic coating, but I prefer not getting water in the ear in the first instance. So they're different tips on what you can do. If you do get water in your ear, try and drain it. You can use a 1-to-1 ratio of rubbing alcohol and white vinegar, which is essentially acetic acid, and place that in your ear. So what the alcohol does, that homogenizes with water molecules. So it basically absorbs the water. And alcohol has a lower evaporation temperature than water, so it really dries up very quickly. But the problem with that is that you can over dry your ear because the alcohol can also absorb some of the internal skin moisture which the skin wants and it requires. Yeah, and the acetic acid helps to re-acidify your ear. So water typically is more alkaline, neutral. It can then possibly lead to a bacterial infection. Because more pathogenic bacteria that are in the ear are neutrophilic. They prefer neutral pH levels. You can also use, we sell it on our website, only in the UK, it's called Clear Relief. That contains glycerol. So glycerol works very similarly to alcohol in that it absorbs excess water. But glycerol, it won't evaporate. It stays in the ear, but it's more of an oily consistency. So it also provides another coating of oil in your ears as a moisturizer. And it also contains lidocaine. So lidocaine is a topical anesthetic, so if there is any localized pain, it will help you with that, hopefully. Other things you can do is a hairdryer, but at a room temperature. Have it too warm and too cold, you're going to get dizzy, you're going to have a caloric effect. Hold it from a distance. You don't want to put it right close to your ears. You don't want to cause any trauma. You just want some breeze. You want some aeration. So even going outside, if it's windy, tilt your head to the side, obviously, to drain any excess more water, but don't poke stuff in like a cotton bud trying to absorb it because you're going to cause trauma. You may push wax deep in the ear. Where are we now? So the eardrum's fully visible. It's just a bit of dry skin around the edge, so I'm just going to peel that away. I should mention to you guys, if you follow me on Facebook and Instagram, you may be aware that I got contacted last week by a production company to appear on a TV show. So I had a discussion earlier this week, and I'm smiling because it's quite it's something that I would watch myself. It's a new show. I can't say anything more other than it's an entertainment show, but it's not something that I feel comfortable doing because it's not kind of why I create this YouTube channel. I really can't say any more, but I'm sure other audiologists would be great at it, but it's not something that I feel that will suit me as a person or kind of my channel. But once this show's up and running, I will kind of let you guys know, hopefully, so you can tune in if you want. So it's not released yet, but it will be shortly. And also, if you missed yesterday's video, anyone who's not watched that, I would recommend you do, because it was quite a surreal procedure. It's something that I'll probably never encounter in my profession again, my professional career again. So I'm going to put the link in the description, but do watch it. So there's a bit of dry skin there, but eardrum nice and healthy. I'm really pleased with that. I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.